Hi, everyone. This is Jody Brook, and I'm here today to report on behalf of the study team, the Community Mental Health Fund's Value-Based Payment Initiative. And I'm going to share our findings from our initial study of this interesting and innovative initiative. So I'm going to share my screen now and switch over to our findings. Great. So this is a preliminary look at the Value-Based Payment Initiative. What we wanted to know here was when the agency trained for their Value-Based Payment Initiative initially. Training is ongoing and as needed, but individual agencies were trained in cohorts. We wanted to know when the agency was trained. We wanted to know their experience with the value-based payment training. We wanted to know their implementation experience, the key performance indicators and several aspects of those. And we also wanted to learn more about the challenges and barriers to successful implementation of value-based payment. So what we learned here among respondents is that a large majority, 34%, or the single largest group, trained about a year ago. Another significant group was currently participating in their value-based training. Another 17% hadn't started training yet. Another 8% began their training within the past 6 months. And then another 15% didn't recall when they received their first or initial VBP training. So among those who responded, the value-based payment training questions had to do really with how they experienced the training. The first question that we asked was, did the training give them a better understanding of their mission and vision? And we had a 5-point scale there where they could strongly agree, and those are in dark green and light green. The yellow is neutral, neither agree nor disagree. The orange color is disagree, and the blue color is NA. And so you can see here that a significant number of respondents did gain a better understanding of the mission and vision, but also a substantial amount didn't agree or disagree with that statement. We can see here that over half of those who responded to this were satisfied with their training and felt like they could explain the value-based payment initiative to a colleague. Many welcomed more value-based payment training, and the training that they participated in, a substantial number reported that it covered the implementation of value-based payment, and another significant portion there said that they didn't agree or disagree, or that it didn't apply to them yet. And then finally, those who reported they had gained more knowledge about data collection through the VBP training, we see that 17% strongly agreed and 25% agreed with that. Another 23% didn't agree or disagree. So that is a highlight of their experiences with training. And I'm going to move on to the next slide. And this is about their implementation experience. So what we can see here is that a large number of respondents believe that value-based payment did help them measure agency access and help them track improvement, as well as helping the agency improve services. And this key performance indicators are a critical part of the value-based payment initiative. And we can see here that a very large majority strongly agreed that they felt competent in collecting their agency's key performance data, that their key performance indicators accurately represent the services that they are conducting, that they understand these KPIs, and that the agency can use the key performance indicators as benchmarks for progress or for tracking. The agencies also felt as though they could develop future key performance indicators. And you can see here that 47% found this concept of the key performance indicators and the value-based payment initiative to be very exciting. So we asked some additional questions here that had yes/no responses. And for value-based payment, we asked whether the focus on agency values was helpful. And you can see there that 62% of the respondents agreed that it was, and that the value-based payments portion, which focused on values, could become financially rewarding to the agency. 72% marked that with a yes. So in terms of the value-based payment initiative, the Community Mental Health Fund and their consultants clearly explained the implementation. 70% of respondents said yes. That value-based payment allowed the agency to improve services. 74% said yes. And the clinical and the billing staff share an understanding of value-based payment. We had 39% say yes. So in this, we had 45% who were unsure, and a small amount, 5% saying no, with 8% or 12% saying that they were unsure. So in terms of difficulties implementing value-based payment, 32% of the agencies did not report difficulties. Did not report difficulties, whereas 17% did report difficulties. Another 31% were unsure, and another 20% said it didn't apply. And if you remember back to our first slide, what you saw is that these agencies are in different places with their training and their implementation. So this is not surprising to us that we saw a wide range of responses here. So along the lines of difficulties in implementation, we really wanted to know what were the largest challenges and barriers to value-based payment. So respondents here could choose more than one. Our top 5 were staff capacity, staff turnover, reporting to multiple funders, time constraints, and limited staff time. So you can see that 4 of the 5 of these really boiled down to the capacity of the agency from a staffing perspective to participate in value-based payment. So staffing is a very significant and predominant challenge and barrier to successful implementation of the value-based payment initiative. And so I've got one more slide to show you here, and that is that the open-ended text and informant conversations yielded some really important information. First of all, that this initiative has helped the agencies with the development of outcomes and data use, that their capacity for evaluation is increasing or improving. What they loved is that the community mental health funds value-based payment initiative is slightly different from others that are routinely used, in that it is agency-centered, not focused on what the funder wants to know. Rather, it's based on the agency's values and the places where the agency wants to grow. What we also learned, and I think you can see this coming through in the data, is that there's not a strong connection between agency administration and agency clinical services in the area of value-based payment, and staffing is a major concern. So we had one quote that I really liked, and it was, "We are changing the way that we practice because of value-based payment." It's not just geared towards a specific evidence-based practice. It's helping us to organize how we do our work. We now look at our organizational structure, what's working, what's not, what are our values, resources, and skills, and how we're doing in terms of outcomes. If we change the system, we can improve practice. It's now how we do business. And I think that this is an overwhelming vote of confidence and support for continued participation and growth in the value-based payment initiative. So that's it for our brief 2, and thank you for joining us.